Good afternoon, everyone. Welcome to Georgia County Health Department Board of Trustees meeting. It is roughly 4 o'clock. I'm going to call this meeting to order. Roll call, Ms. Pinkley.
Mr. Hague,
I am here.
Dr. Henry,
Here.
Ms. Stidham,
Here.
Mr. Deal,
Here.
Ms. Taylor.
Present.
We have established a quorum. Ms. Henry, would you please read the mission, vision, and purpose?
Yes. The mission is to promote positive health outcomes through delivery of foundational public health services. The vision is a healthy Jefferson County. The purpose of the health center, JCHD, is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much. I will now entertain a motion either for approval of the agenda as presented or any motions from the addendum.
I have an addendum.
Yes, ma'am.
And under new business, item number 4. The amount of the grant is $262,243.20.
62.
243.
Yeah, I got it right there. All right. Good words. There, right? Is there any other? I'm sorry, we have that, correction on the table. Is there any other addendums? So making the correction to number 4 under new business from 206,754 to 262,243.20. There's a motion. Do I have a second?
Second.
Is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Now we need to approve the amended agenda, please. Can I have a motion for that?
I make the motion to approve the amended agenda.
Second,
Second.
having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Welcome, Gus. Thank you for attending. Next on the agenda is approval of the October 2nd, 2024 work session meeting minutes. So I have a first for that motion.
I'll make a motion that
First, I have a second.
Second.
Second, all right. Any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is the approval of the October 30th, 2024 meeting minutes. Do I have a motion for that, please?
I move to approve the October 30th minutes as written.
Do I have a second?
Second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is the approval of the November 13th, 2024 special meeting minutes. Do I have a motion for approval?
I'll make a motion.
Do I have a second?
Second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is approval of the October 2024 expenditures for $206,025.03.
Make the motion to approve.
Do I have a second?
I second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next is approval of the October 2024 electronic payments for $492,874.85. Do I have a motion?
I'll make the motion.
Do I have a second for the approval?
I second approval.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is pre-approval of the December 2024 electronic payments of $647,247. No cents. Do I have a motion?
I'll make the motion.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next on the agenda is the director's report. Mr. Sykes?
Okay, not a whole lot here. I just want mainly to update the board on a lot of some projects that we've completed that's been ongoing. I think the admin staff are glad to see some of these be completed. The HVAC replacement repair that we've gone through, that is done. Mr. Crawford informed me that it's been inspected and approved. So I think we've made it through the hail damage of all of our systems here, and it's updated. And I appreciate Mr. Crawford working on that, spearheading that project. Also, another big project was the employee salary compensation study that's been done and been approved by the board, and the employees did receive their letters regarding how that study affected their wages. Also, the new job descriptions have gone to the employees. This was tied very closely to the compensation study. To make it more accurate, we had to make sure that our job descriptions fit the job descriptions that they went and looked at. So we updated those. Then the other thing was the exemption status of employees to ensure we're in compliance with FSLA requirements. And we have done that here. So these have been a long time consuming projects, and I just wanted to update the board that's been done, do a lot of hard work of the administrative team. Also, I believe Melissa has put this in her report, but I just wanted to throw out a big thank you to all the staff and Brian, as well as on the school-based flu clinics this year. They were really good, big success. And so the nurses at the schools really helped out this year, making these clinics a lot bigger than they have been in the past. So that's just another opportunity that our team took to get out in the community. And that is the highlights of my report. Any questions?
Here's none. Next on the agenda is clinical service report from Melissa.
Good afternoon. Last month during our meeting, it was requested to hear from our registered dietitian. So I will be introducing her, and Brianne's pulling up a PowerPoint that'll go over her services here, but I wanted to take the opportunity to ask before she gets up here if there are any questions about the overall clinical report that was in your packet. Okay, I'd like to introduce Megan Lash, who's a registered dietitian.
You're gonna click through that for me, Brianne, or do you have a clicker?
Yes, I will click through it.
Thank you.
Welcome.
So thank you on this screen.
Right, yeah, so my name is Megan, just a little bit about a background about my role here and what it takes to become a dietitian. So I did get my bachelor's in dietetics at Iowa State University. After that, you are required to do a dietetic internship, typically between 9 and 12 months. So I did that through SEMO, but most of my rotations were actually up in the St. Louis area. So my clinical rotations were at MOBAT, and then different community sites such as DeVita and WIC. Before taking this position, I do have some clinical experience at a couple different hospitals, Hannibal Regional and Blessing in Quincy, Illinois. So I covered the ICU and different med-surg floors at those locations. The process of becoming registered as a dietitian. So after you do well, now it's required to have a master's degree, but anyone that has a bachelor's is grandfathered in up until 2024. So now it's a master's degree, the dietetic internship, and then you have to sit for the national exam. And then continuing education is 75 credits every 5 years. And then I'm also licensed to practice in Missouri through the Division of Professional Registration. Then my role here, I've been in this position, it'll be 6 years in February. So what we offer is nutrition counseling free of cost for any resident of Jefferson County. This can be provided in person at either of the offices. I can do this virtually or over the phone, so we try and make it as accessible to people as possible. We try to make it really simple to get in as well, so I do get referrals from different providers in the county. But there's also a form that people can fill out on our website, and that will send an email to me so I can reach out to them directly. Again, we try and make this as simple as possible, so I know on social media, even will post that my services are available and they have my extension directly. So they can just call and we can get that scheduled as soon as possible. The clients that I'm typically seeing, a lot of it is people focusing on their weight management. And then, of course, the most common would be things like diabetes, high cholesterol, heart disease. Those are the most common patients that I will see. Outside of that nutrition counseling, I do work under a couple of different grants. So our maternal child health grant, so this is for school-age children and mothers. Our 5-year focus on this grant term is promoting protective factors for youth and families to prevent suicide and self-harm. So what this looks like with my role is partnering with schools, farmers markets, different community organizations, providing nutrition education, physical health education, kind of as a coping mechanism for that bigger picture item. And then I also work under the Child Care Health Consultant Program. So this is for the younger kids, so up until kindergarten. So I will go into some of those centers and provide health promotions. And then we also do clock hour trainings for child care providers so that they can meet their continuing education requirements as well. This is going a little bit back to the nutrition counseling process and what that looks like. So a typical client that I'm meeting with for weight management, we're trying to establish that baseline of what their intake patterns are at baseline. And then from there, we're going to try and set 1 to 2 short-term goals. This isn't going to be necessarily related to the number on the scale, but more of action items that we can work on to help, in general with that process of getting the weight off, but not necessarily tying to specific numbers on the scale. In the beginning, I like to check in with them pretty frequently. So we may be meeting, every 2 weeks starting out. And then as we feel comfortable with our progress, we might meet more like monthly to check in and see how things are going. For something more specific, such as a diabetes diagnosis, again, I'm going to try and establish that eating kind of baseline where they're at, go over lab work and medications. And then education is just going to vary from person to person, whether it's something more general, kind of meal planning based off of a plate method, or getting to more specific carbohydrate counting, depending on where that person's at. And with that, the follow-up is going to be kind of as needed. So I'm certainly open to meeting with them more frequently. Sometimes it might be, every 3 to 4 months when they're getting that new A1C drawn, and we can see how they're progressing that way. And then this is all documented in our electronic medical record, QRMD. And then this is the last slide, but just a little bit, my patient load is going to vary at any time. I'm typically working with 5 to 10 clients at a time with, again, varying degrees of follow-up. And then a couple of just brief success stories. So this first client I met with last March, that hemoglobin A1C was in the pre-diabetes range, and her LDL, what we coined the bad cholesterol, was elevated at 134. We went through some education on nutrition guidelines for those items. And then she returned actually earlier this month. So her A1C was down to 5.7, still in that pre-diabetes range, but just barely. So saw some improvement there. And she had, again, almost gotten her LDL down to that normal range that we like to see below 100. And then the second one is more of a weight management client. So I've been working with her very consistently over the past year. I've seen her actually 20 times over the past year. She started at 166 pounds. She set a goal weight for herself of 145 pounds. That's where she thinks she's going to feel comfortable. We're a little over halfway there. But, small progress is still progress. And the fact that she's learned that and hasn't moved in the other direction again, it's considered a win in my book. So that's what I had. Are there any questions that I can try to answer?
Are you prepared for more patients and people coming, clients to see you? It's
I
probably
mean,
gonna happen.
okay, yeah,
So I do have a question. Have you ever done any, do you do any group? Like consultations or education
we've
classes?
done some programs, specifically through that MCH grant where we brought like families in, to kind of cover the
I
whole
was just
family
wondering
unit.
if a community group thing would be something that,
Mhm.
I don't know, just a question more than an answer or a suggestion, just potential. I was thinking, so.
Yeah, I've had, some people mention, kind of weight management support group, those types of things, but I'm definitely open to other ideas like that.
Are most of your clients fee for service referrals from the primary doctors, or where do they come from usually?
I would say it's a good mix. Yeah, like I said, we get the information on social media, so I get some people that way. I get some internally from our nurse practitioners. And then, yes, some of the different offices, provider offices throughout the
So
county.
those without insurance, what about those?
Yeah, it's not anything that we charge for, so,
Okay.
yeah. And typically insurance is only gonna cover medical nutrition therapy for diabetes and kidney disease anyway, so it's great that we offer that
Yeah.
for those other conditions.
Thank you.
You got a question?
I do. I have a couple questions. With really coming in like all the toxins in our food. We're at 40, 5. What is your take on where we are as like a country or county? Just in general about our food intake and the toxins and chemicals that are really starting to come out now.
Like, sure. So I don't think our food system is perfect by any means. I do think a lot of people kind of get caught up in a lot of the details when most of us, if we got back to the basics of really following the guidelines that are out there. I mean, 9 out of 10 of us are not eating enough fruits and vegetables. If we could get back to those basics, I think most of us would be doing pretty well as far as our nutrition goes. Not to say that there's no room for improvement with our food system. But I have a lot of people coming in and they're just so overwhelmed by all the information out there that they're almost kind of frozen.
Right. And processed foods, seed oils. Have we thought about, or has that, like, have you thought about? And like in your teachings, do you teach like sugars, refined sugars, flours? I mean, do you get into that detail? Try to stay away from processed foods. And I guess what I'm getting to is as a country, we are the sickest country civilized in modern world, right? Have you thought about how we would try to get our county healthier by our food? I mean, is there like, Tinta brought that up about having group things. Is that something like, how would we promote that? How would you want to do it? Or what do you think we can do to make our community healthier? Is it more education? Is it giving you an assistant? Do we need another dietitian? Because chronic disease is rampant. I think it is mostly diet.
Diet's a big part of it, our activity levels, of
Yes.
course. I wish I knew what the magic answer was. Unfortunately, I don't know. The processed food is rampant. I mean, it's easily accessible, but we also have to think about, people's access to food in general too. So yeah, that's why I kind of say get back to the basics. If we can get people eating the fruits and vegetables and lean proteins and whole grains.
Well, and on the food pyramid, they changed it now, like so many of the main part of the diet, if you look at the food pyramid, is breads and pastas.
Yeah, I don't think carbohydrates are anything to be feared. It's all about balance and, trying to find that overall balance. But yeah, as far as, changing countywide or nationwide statistics, I unfortunately don't have the answer to that. But I'm trying to reach as many people as we can.
Okay. Yeah, I would like to, for us as a community or board or the admin staff to really kind of look at that as being, you being the forefront of trying to get people healthy. And if you need more help, I think that's something we really need to talk about, because I think it's coming down the pipeline. I think it's being more nutritious.
I'm sure you have a lot of contacts and literature that you read all the time and licensure, you have to go get your CEUs probably, right, to keep maintaining a license. So I'm
Yes,
sure
yep.
a lot of this discussion goes on all the time, doesn't it? So
Yes,
I'm sure you'll be upgrading things as we go along.
yep, it's ever changing. Nutrition is not an easy science to study.
It shouldn't-
There's so many variables, but
Yeah,
It's always
nothing
changing.
should ever be status quo. When it is,
Right.
then there's usually a problem with that. So thank you. Is there any other questions? I'm sorry.
all right, thank you.
Thank you very much.
Thanks, Megan.
Thank you.
Thank you, Megan. Any other questions about the clinical report?
I have one. So I've recently asked about our medical director. And I guess we don't have a contract with him. We don't pay him
We
for
have two different
service.
medical directors,
The one
one we
over
have a
vaccines.
contract with and one we do not.
So why, someone that's overseeing health of our county, we don't have a contract, like how did he come about? How long has he been working? For us, and on most health departments, they have their medical director listed on their website, we do not. So I'm just wondering, like, how long, how did he get the job? Like, does he have some kind of job description? And, still not sure like how he gets paid. I mean, people.
So some of those things are before my time, so I can't give you a solid answer as to how it came about. I can tell you involvement, and from a perspective of what we do now, he is involved in our current standing orders that are updated every year.
Okay. That he does that because, and that's why I asked for the nutrition. He specifically treats chronic illness. But he's over our vaccine program.
So
And
that's part of what he is over. He's over all of our standing orders. So
For
vaccines is
everything.
under,
except for OBGYN, correct?
that's correct.
Okay,
Yeah, but he is involved and he has to sign off on our standing orders. I think that maybe you had those in your packet, so
Yeah,
you can
thank
take a
you.
look at that and see if you have any questions about the overall standing orders that he signs. I can't speak to the history of where some of that came from and what those practices were whenever he came on board. But
How
I
do
do
we
know
find
he's
that?
involved.
how do we find, like, how did he start? How long has he been working? Where did he start?
So I can
Was
give
he
you-
hired? Yeah, I'd like to know, how that came about, because if we're not paying him as a medical director, that nobody just does all of that work for free.
Well, actually, Mercy has a requirement of their physicians that they do so many hours of community-based service level. And I believe it's that some of that came about as part of that, and this is his community-based.
So he does it for
Service.
free because he's
I'm
required to.
not sure if that's
the
where it
part
came about.
Was done under the previous director, so I'm not sure. I tried to do a little research on the exact time when that all happened, but that's what we kind of felt was what was going on there, that was on their end, that was not under contract. On Mercy's part.
I guess just from where I'm sitting, that we need, like, I wanna see what his job description is, like who's covering this malpractice? If he's over our standing orders and there's a mistake or something, like who, do we cover his malpractice? Is he covered by the hospital? Does he provide his own? You know, I would like to see, I think we should have
Why
something
don't
in writing.
why don't you give us your questions and we'll try and follow up on those.
Okay.
That's not something standing here, I'm gonna have those answers for you today.
Isn't the medical director paid salary through
Most of
the
it.
hospitals normally in the county that we're in? Is he?
So I'm not sure how the hospitals fund those medical directors. I don't know if it's strictly from fee or how that goes about.
Seems it's mandatory that we have one. I mean, there's a
Right.
need for a medical director.
Some health departments utilize state medical directors. So every public health department looks a little bit different with that and how they get their standing orders. Some use state standing orders.
As long as I remember, we've had a medical director in the
Mhm.
county, so. Remember one.
There's a long history with the state. They had a long-standing medical director who signed whoever wanted him to sign their orders, and then he withdrew from that, and that caused all the health departments to have to scramble to find someone who would sign their standing orders. And to be honest, historically, it's been a case of finding someone who's willing and able to do it. And obviously you want to have a qualified person and have a good working relationship. I don't know what's been happening recently with that. I could tell you Dr. Stansfield for years was our medical director.
And he was contracted, right? I mean, was he paid
Yeah, and then
or not?
he withdrew because of concerns with his malpractice insurance. So that's been part of the issue over the years too, so.
Well, that's what I was asking, like, what if there is a lawsuit with, we don't have a contract with him? And he's not getting paid, but he is on like our vaccine order, so he's over the vaccine program. I'm kind of like, what does he know about vaccines for childhood vaccines? Does he have any, what I saw, what I could find online was just he treats chronic illness. So,
I wouldn't think he had to be proficient in anything related to vaccinations. I think overall as an MD, I think it's all encompassing when you think of what he would do as far as the standing orders. So he
and that's
doesn't
why, like,
he
who's the
doesn't
ones
set the
going over those?
vaccine
I think we just,
protocols or nothing,
can
policy.
we hear from him? Can he come and
I
speak?
can
Or
request, sure.
I would just like to know where where his stance, if we're trying to make our community better, healthier. He oversees chronic illness, like what does he do in his practice? What does he promote? One, I think is nutrition's huge. Is he sending his patients to our dietitian or to other dietitians? I just would like to know kind of what his stance on is trying to make people healthier instead of being. For me, when I see that he treats chronic diabetes, chronic hypertension, all these chronic diseases, what does he do to try to make more preventative? And that's where I'm going.
Okay, so you would like to have some education from him?
Yes.
Okay,
Like, what is your stance on before they get to him to take all these pills, get better? What is he doing to try to promote? Because if he's overseeing our county and our health, I think
I think
You know where I'm coming from?
Yeah, but I think he specifically just oversees what our standing orders are. I don't think he gets deep in the weeds with our clients.
most of our programs are covered by either state requirements, contract deliverables. But he does have to be able to sign off that, yes, this is an acceptable practice under our standing orders.
okay. Cause he is the one, if there's a question, we would go to him for everything, correct? Do we
It
ever?
depends.
Yeah.
Sometimes we go to the state. It depends on what program that is and what it looks like. If it's something for epidemiology, we might go directly to the medical director there. If it's something that's an overall question, we might go to the state medical director for a specific program that's, we're carrying out here. But if it's something where we're trying to determine, should we do something or should we not, that's not guided by our state programs, then we would reach out to him.
Okay.
Right, so you got information,
Yeah, I'd
Send
just
it- I
like to
mean, just go
know
ahead
how
and
he came about
send your
and
questions and.
would we ever look at somebody else that's maybe on the more proactive side of treating illness and getting people healthier?
Thank
Thank
you.
you, Melissa.
Thank you.
Alright. Here we are. Public comments. Is there anybody here for, I'm sorry, I lost my place. Is there anybody here for public comments? All right, going once, twice, all right. Old business, new building, old business with the new building updates. All right.
So, I think you all saw some of the slides that, the video footage that Brianne put on, the building's come along. It's on track with the dates they put forward. the contractor told us at our last meeting that they basically have three phases of the building that how they're working on it. Clinical area is the first phase, and we're actually seeing, walls being painted in that area. Drywall is up in all the phases, but some of it still needs to be taped and mudded. And I would assume that's getting close to completion. They're putting up the ceiling tile grids, to put the ceiling tiles in at some point. The electrical and plumbing finishes are being installed in phase one. Again, that's a clinical area. One little issue we have, well, it's not little, but Spire, we're still waiting on them to put the gas main in. We need that in order to keep the building heated, which you all know that for painting and taping and mudding, you have to have a certain temperature in there. So we're working on that. Our furniture selection was completed on November the 5th. We're just waiting on them to come back with a quote on that final selection. I don't believe we've received that yet. And we're still working on the technology aspect. This has been kind of a little bit of a pain here, getting everybody together on the same page, working with our existing vendors and the subcontractors to put in systems that work with the systems that we already have in Arnold, to match up so that our existing providers can work in the new building as well. We're working on a moving plan with the administrative team. Mr. Crawford is spearheading a lot of that, especially with the quotes with moving companies coming in and trying to give us a good idea of the best way of moving our items from this office over to the new building. And again, the timeline is still for April 2025. And Tim had mentioned the board, it's getting close to another tour of the building. We'd like to do one in December. In my notes here, I put December 30th, because that's our board meeting, but that may be too long. What do you think? You think that'd be all right? I think it's at 1 o'clock, right, is our next board meeting. We could go afterwards. That way the workers would be done and take a quick tour if everybody's in agreement with that. Hopefully they'll have the building heated and.
On Monday, on the 30th,
Yeah, I believe it's a Monday.
1 o'clock's tight for me.
It's
I
not,
worked the night before.
it's not good, or it is?
I usually don't get home till 9 or 10 in the mornings.
Okay.
Could we, if we did a little bit later?
The board meeting's at 1, I believe.
Oh, we did do that? Oh,
No.
okay.
Wow.
Yeah, I don't know
I'll
why,
be here, yeah.
why it was.
It is at 1.
Is it on the, I don't know, I can't get into my calendar right now.
Here we go, their phones.
You're right.
Maybe I have that.
Exactly.
Paper, pencil, electronic.
The 30th at 1 o'clock.
It's at 1 o'clock on the 30th.
30th, Monday.
Oh.
Okay, all right, we'll do it.
Well,
We'll be here.
if you, it's, if you can't make it, I'm excused, I mean. When he gets out of, you don't wanna miss the tour, okay, well, you
No,
come later for the tour.
Well, I'm not gonna, I mean, I'll just.
All right. Anything else, Mr. Second?
No, so you want me to go ahead and set it up?
Yeah.
Okay. On that 30th. Okay, no, that's all I have on the board report. Or the,
Any
Building
questions for?
So they're gonna do the tour after the board meeting?
that way the workers are gone, hopefully. I have to drag the meeting out slowly.
Give him time to finish.
Is there a reason we did 1 o'clock for the board meeting?
I know, that's, I'm like,
Maybe we send a doodle poll out.
Well. If the board wishes to change the time, we can do it right now. But it's
What time do the guys leave over there?
Around 3:30.
you wanna move it back to 3 o'clock?
that'd be great for me.
Does anybody have any objections to that? Make that change.
Is there?
Well, then
okay
just
for you
moving
guys?
on.
I mean,
All right.
It's just, I'll leave
The
it.
board will be at 3 and then we'll go
After.
after the.
Mhm.
And please rescind the invites. Thank
Does it
you.
make any difference if it's darker now?
Wow.
No, they have light. I'll check with them, but I know they have some lights in there.
We'll
And
have,
heat.
we'll have a quick board meeting.
Yeah, yeah.
Lights and heat.
If they come back and say, no, that's not possible, just have to make another date
Mhm.
for it.
No, we can do them, but I can do one. That's fine, I can do one.
As soon as you can get done.
I go before
Three
the
would be
board
better, but-
meeting or something. All right.
Yeah.
Had the board meeting over there.
Yeah.
Not yet.
It's better for you, yeah.
All right, so we're gonna move on to new business, and the first thing on that new business line is act on recommendation of the Personnel Committee for recommending for Executive Director. So, boy. Hold on, I lost my stuff. What's wrong with that? There we go. There. Sorry about that. Technology. All right, so I guess we're gonna need and the recommendation was to, promote Mr. Sykes into that position, correct?
Correct.
So we need a motion in a second, and we can have further discussions.
Dennis and I made the recommendations. Don't we make a motion too?
Yes,
I'll make the motion.
you're still a board member. We have first, do I have a second?
Recommendation.
I'll second it.
All right, we have a first and second. Discussion points. Questions, thoughts, concerns, let's go.
So this would be, on the contract that we've all agreed to.
The last board meeting.
The last, yeah, when we went over all that and closed. I know that Mr. Sykes brought some concern about me about attempting to backdate this one to the 16th. Of this month. My question was that a thing we can do, or should we just move it forward to the?
You can, the contract's not active until the board approves it though. So you can have it effective. This is a question of whether you can have it effective November 16th as opposed to today.
I told him we could just make him suffer and he just deal with it when he deals with it, because, I mean,
That by your bylaws, the contracts are not active until the board approves them.
it's all about payroll stuff
Right.
with it where it
Yeah.
falls.
And I'm sitting here
And we can make it.
Why you asked? I thought I'd put it out to the rest of the board.
payroll. The 16th is our payroll.
I know it wasn't you. I apologize. Okay, so we're just gonna go with it as it is, and your payroll people are just gonna have to figure out the cents and the dollars and divide it.
We'll,
You and
we'll figure it
I'm
out.
sure you will. Any other discussion points, anybody, concerns? Not hearing any, I'm gonna call for roll call vote.
Mr. Big,
Yes,
Dr. Henry,
Yes.
Mr. Deal,
Yes.
Ms. Stidham,
Yes.
Ms. Taylor.
Yes.
congratulations, Mr. Director.
Thank you all.
Now I'm gonna get you to make your harder work, right?
You do what?
And make you have more work, harder work.
Yeah.
All right, so now your first act is to go over the 2023 Jefferson County Health Department audit. And you're gonna pass that buck.
Is it getting ready?
You learn quick. Kirsten, thank you.
So we finally got our 2023 audit back. I'm just gonna go over some quick points. In their opinion, the financial statements referred to are presented fairly, which was a nice clean audit, like an A.
Good job.
Thank you.
Congratulations.
Reporting on internal control, during their audit, they did not identify any deficiencies in the internal control. Yay.
Very good.
Let's see, they audited two major programs, Title 10 and Workforce Contract. They did not identify any material weaknesses or significant deficiencies or any non-compliance. And we are qualified as a low-risk auditee, which is great. Yeah, and there were no prior year audit findings to act on, so that is
No recommendations.
recommendations.
It's unusual. Congratulations.
Thanks, and it wasn't last year either.
You don't have any recommendations out of an audit. That's really unusual. That's, congratulations.
Thank you.
Anybody have any questions?
Do we have a contract for future audits with them or not?
We do not, we need to go out to bid this year, so I will be working on that next.
Is that a requirement? Did you have to do that every year or
Every 3 years.
every 3?
Yeah.
The audits every year.
Yeah, the audits every year.
Oh, the audit,
And we
and then
go out.
we do it every 3, okay, yeah.
Any questions? Thank you very much.
Okay,
Just stay there.
I will just stay here.
Next.
That's me
This one is,
again.
before we get deep into the hole, hold on. This is approval of the 2025 Jefferson County Health Department budget. I need motion in a second, and we'll have discussion.
I will make the motion.
Do I have a second?
Second.
Having a first and second, discussion points. Do you wish to just kind of give us an overview of that?
Sure. The budget's
It's
pretty
in the
much,
packet.
yeah, it's in the packet. It's pretty much the same as last month, with a couple differences. We have an increase in expenses of about $11,260. It is because we put money in there for the HIPAA legal expense. To have lawyers review that, and then nursing had some IT needs that were about 5,000. So that's approximately the change.
Anybody have any question over the budget? Or comments?
I mean,
Okay, not hearing any other comments or questions. Gonna ask for a roll call vote on approving of the 2025 Jersey County Health Department budget.
Mr. Pig,
Yes.
Dr. Henry,
yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
Budget has been approved. Congratulations.
She's like that with, just like that.
All right, and the next on our agenda is to approve to submit application for the National Environmental Health Association for the $262,243.20. Do I have a motion? Approval. We'll have him come up.
I will make the motion for approval.
Second.
Second.
All right, with first and second. All right. You wish to come up and talk about your grant? Or somebody wish to come up and talk about the grant?
You introducing it or am I? You're up, you go ahead. I'm Dan Kane, the environmental supervisor. So with this grant, during the 2025, 2020 through 2027 budget period, the agency plans to reassess and do a self-audit on all 9 program standards. I know Alicia, our program coordinator, she gave you an overview of the standards program earlier this year. So this funding would allow for the continuation of the part-time coordinator position, which is half of Alicia's salary. Then it would also fully fund the environmental food inspection software. Citizen Serve is the inspection program that we use. And then it would also provide the structure and resources to complete foodborne illness training and complete an exercise. And then it would also fund any legal fees that are associated with the review and potential update of the Jefferson County Food Code that we would hope to update next year. Included in this grant also is our training budget we have 9 inspectors, plus myself and plus Alicia that would be included in that.
So that would allow us to go to different conferences, and different training events, also. In the packet that I handed out to you, it kind of gives an overview of all the expenses, that we, and everything that we'd be using this grant for. So it's a 3-year grant. In year one, we are asking for 100,000 and then $644.40. Year two is $81,225.60. And then year three is $80,373.20. So it's a grand total of $262,243.20. Want to talk about what those grants has helped us do in the past, like previous grants?
Well, this particular grant program began in 2021, so we were part of the very first cohort of awardees. We received the track 3 grant, which is the same one we're applying for this time. It was a 3-year grant. We are coming up on the end of that grant cycle. We'll be submitting final reports and documentation for that here in about a couple months. So we're in a good position to receive it again. We're sort of the ideal candidate for this program, or what it's designed to do. It's designed to help programs like ours pursue conformance with the FDA retail program standards.
Is there any questions?
Yeah, my first question would just double check, and I didn't see it. This is a straight grant. There is no share cost to this, right? This is 100%. Okay, that's my only question. Anybody else?
Is this about the same amount that we received last time? It's actually more. Because they changed the structure of the grant program, they combined a couple of things into it, and so, that's the short answer to why it's more, but you can see all the items in there that it's gonna cover.
The start date.
Well, this is just to apply for it. So
When did it start?
The grant period starts January 1st, so 2025.
Let's see where the trainings, the CY25 only covers for the next year, so you'll have to redo for 26. Each year you have to re-up for
The
that.
training portion, yes,
Okay.
reapply.
Is there, we're applying for this grant, is there information on what's required of us to do? What's
Yes.
required in order to get this grant? Is that available to see?
It is, I can get that to you if you'd like. It's rather involved. I'm happy to send it to you. Okay, and answer any questions as well.
Great, thank you.
All right, go ahead and answer any other question.
When's the application have to be sent in?
So the application has been sent in on November 20th.
Yeah.
So if it's not accepted, we would just have to not accept the grant,
that was the deadline, so we had to go ahead. I went ahead and told them to submit, but we can retract. There's no question.
All right, so we have a first and second on the floor to approve the submit application for the National Environment Health Association. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Good luck. All righty. And we're to act on recommendation. Oh, this act on recommendation of the executive director recommending for the monument sign for new Hillsborough building. Mr. Sykes.
So Steve, you can come on up, because I think Steve's put information in front of you on the monument sign. He's put a lot of work in. Like, it's none of these things, when they submit their bids, they're all over the place.
Hold on a second. We need a first.
I'll make a motion.
Thank you. There's a
Second.
motion. Do I have a second?
Yeah.
And first, second, now continue. I apologize for that oversight.
So the bids came in all over the place. None of the bids, there was not one that was completed. Steve had to do some more checking on things to come up with what what the recommendation would be. Really, I guess it'd be best if you wanna run through it.
So we had 5 companies, of course, submit bids. None of them provided a complete picture of what they were gonna provide. So I had to send out emails to all of them and I gave them a due date of November 20th at noon and only had 2 make the date. So using the information they provided, looking at the overall conceptual drawings that were provided on your table is the concept that we want to go with. And that's because it is the most complete concept. And the one concept that actually utilized the building drawings, the building specs that we provided in the bid packet to demonstrate what they will build for us. So it's the most complete submission that we have of the 5 bids. And also, from my perspective, the company is a local company to Jefferson County, and it's the only local company to Jefferson County to submit a bid. All the other companies are either out of state or out of the county. They also submitted a concept that's larger than what we requested in the RFP. We requested 80 square foot sign. They submitted a, I believe it's 90.5
90.7.
yeah, 90.7 cubic foot concept. The nearest concept was 74 square feet, I believe. So, I think that's the best bid for us.
Yeah, cause if you look at their bid, 49,000, but the square footage of the sign, it really, per square foot, it's not
Yeah, it's 500 and
the highest bid.
it's $547.98 per square foot for that concept. The next highest bid was $390 some dollars. So
I like the design.
I do.
I think it's a good statement piece.
And we will have to get this approved by the owner of but I don't see any problems with that. He's been really easy to work with. There are covenants where we are at, he'll have to approve the sign.
I'm sorry, I'm confused here. So which company are we talking about?
Warren sign.
Okay,
And this is that's the one, yeah.
okay. So. Is this a lighted sign? It's hard to tell.
It's LED illuminated from within. So it is
like
lighted.
plastic or what?
It's a vinyl with aluminum base and aluminum base and supports.
And where's it gonna be?
It'll be, there's actually, if you want to really look where it's gonna be, if you go down to the building site, there's literally an orange T-post where we plan to put it.
It's up on the hill though.
By
It
the
won't
driveway.
be down in by the building.
So it'll be visible from both directions along,
Highway.
so from 21 and even BB, you can possibly see it.
Okay.
So the most when you first pull in and we make a right when we go down there for a visit, is it up higher on the hill?
Yeah, it's higher. Yeah, it's really where the road turns.
Okay,
As you're going from like 21 to the Express Mart, it's as the road turns, it's literally in that spot.
I like it.
Were they the most complete bid, you said?
They were the most complete bid from the outset, even though they didn't provide all the details I was looking for from the original review of all the bid submittals. Their bid was the most complete bid, and then literally within a few hours of my request for additional information, I had the additional information I needed.
Those golden rules, you said they weren't even really in the
Golden
running.
Rule did not even respond to my
Right.
email,
Right.
so.
Mhm.
Any other questions?
I'm guessing, oh, sorry.
And this is within our budget that we allotted.
Yes,
Well, in the budget.
This was probably the nicest one. Did you think this was the nicest design? ever?
absolutely. It knocks all the other ones
Yeah, I'll get.
Yeah,
to the side.
Well, it seemed to kind of work out then, local and fits the budget and
So the plans to put that in when all the other construction's finished?
No, we give them a due date to get it done by March 31st of this year.
Okay.
2025. Just have to put a cover over it for a while.
All the people in China, yeah.
For the grand opening.
Any other comments, questions? Okay, this is to approve, is a warrant sign, correct?
Yes,
Warrant sign for, how much was the bid, sir?
$49,702.
Okay, so we have a motion and a first on that. Any other discussion? Last offer discussion points? Not hearing any, may I have roll call please on this?
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
We got a sign.
Thank you.
I love
Thanks, Steve.
I do too. I was
Thanks for
very
all the work.
impressed. with
Yeah,
it.
thank you.
The detail was excellent.
I know. You liked it a lot.
And the report.
All right, and next on the agenda is to entertain any topics for the next agenda. We need 3, must have a second for that to be placed on the agenda. Anybody have one? Want to throw out? All right, not hearing any, let's call. Any need for closed session?
Gotta approve, closed session minutes.
Okay, somebody needs to make a motion to go into closed session. You want to hold it till next one? We'll take a 30-second closed session.
I'll make a motion. To go and close.
Just like you
Do
said.
we know to close, open and?
It's closed and, it would be, I guess, for 610.021. Whatever subsection being, I guess, 14. Approval, just to approve the minutes. All right, so we have
Can I ask a question first?
so we have a discussion point.
So we got kind of 2 different sets of information on immunization contracts, which we had asked for. And I don't know what's what here. There's some in this packet and there's
That is
some.
the information that was requested last month.
I asked to see, I asked to see
But
that.
there's some in,
In her report, her.
In the
Yeah,
report,
That is
too,
from the
yes.
PFC audit.
Yeah, what was in the clinical services board report, we had a VFC audit this past month, and those reports from both Arnold and Hillsborough are provided in your packet.
okay, so that's why that's in there,
Yes.
for the audit, okay. I'm sorry.
Nope, you're fine.
Did you see this before now? So I was just curious.
No, I haven't
whether-
looked at, no, this is the first time I've seen it.
Whether it answered your questions or not.
No, actually.
Well, and I may. Have questions on this and I'll
Yes,
just,
that's
I'll
fine.
to get them on the agenda, but I guess we are all open to ask questions about it next meeting.
Or you can just,
Put it on there now.
if you can ask some of these questions, because if we need to research,
Okay.
we may not have an answer for you at the board, you could send it ahead of time, we would be able to get those.
It's really the better way to do it.
Okay.
Steve. That way you get your answers probably faster, right? So we have first and second going into closed session, roll call,
Mr. Pig,
yes.
Dr. Henry,
Yes.
Ms. Stidham. Yes. Mr. Deal,
Yes.
Ms. Taylor.
Yes.
All right, we will not be coming back because there's nothing else to report out, so thank you very much.
Thank you.
Thank you. Thank you.